Welcome to Arirang TV's continuing coverage of COVID-19. I'm Min Sun-hee. We're starting our program about half an hour later today to accommodate a briefing session by authorities here regarding their decision on social distancing in the metropolitan area. The stringent and so-called level 2.5 social distancing guidelines are poised to end this coming Sunday. Now, there has been much speculation over whether or not these guidelines will be extended, and we're hoping that the briefing right after will let us know if they are going to be extended or not. Now, the daily tally has been on the decline, but there has been a rise in the number of critically ill patients as well as a growing presence of asymptomatic carriers, making our officials here very cautious about their future plans with the social distancing measures. We'll start the program now with our Kwon So-ah regarding the numbers for Korea on this Friday, as well as those figures for the countries across the world. So-ah, how are we ending Friday here in Korea?
Well, Sunny, Korea's cases of COVID-19 look very similar to Thursday, standing at 198. So yesterday we had 195, and 189 of those cases were local infections. So for the second straight day, the figure has been below 200.
Right, and this is why the government is very cautious about its future plans regarding social distancing here in the metropolitan area.
Exactly, and that is why we are expected to hear from Health Minister Bang Neung-woo later on whether the social distancing measures will be extended for a week or not. And social distancing is really important to get the numbers down. Let's take a look at the figures today. The figures compared to last week, we are seeing a gradual decline in this 8-day span that we're seeing on our graph here. And as for the details of Friday's figures, we have a total of 20,842 cases, again with 198 new infections, and the fatality stands at 331 as we have 2 additional deaths, 58 people less in quarantine, and 254 new recoveries. And if we go over to our map, we see that the metropolitan region has the most cases, again with 68 in the capital, Seoul, 56 in Gyeonggi-do province, and 5 in Incheon. And those account for 129 cases today. So we are seeing a decline in this region. In the meantime, we have double digits here in Gwangju as well as in Chungcheongnam-do province, 21 here. And I mentioned this place yesterday because there has been an outbreak at a kimchi factory, which has been adding numbers to this region. And also we have 9 cases that were cases from abroad this Friday. And speaking of that, let's take a look at the international figures. Almost 290,000 new cases were reported in the span of 24 hours, with almost 6,000 new fatalities and nearly 220,000 new recoveries. Let's take a look at the hardest hit places around the world. The U.S. at 6.3 million and Brazil at 4 million. These two countries are adding some over 40,000 cases on a daily basis, but India had more than 84,000 cases in the span of a day, which means this country has a record high of a single day rise in cases. And let's take a look at other places across the world here. South Africa and Mexico all in the 600,000s, and Argentina over here at almost 541,000. That is, this country has been adding more than 10,000 cases on a daily basis, so a big concern over there as well. And those are the updates I have for now, but I'll be back with more after the later afternoon briefing. Back to you, Sunny.
All right, so thank you for that. Right, here on the local front, as our Kwon So-ah mentioned, daily cases have been on a slight decline this week. And in response to this, the authorities are going to decide whether or not to extend the 2.5 social distancing guidelines here in the metropolitan area. For more, I have our Oh Jung-hee in the studio with me. Welcome, Jung-hee.
Good afternoon.
Right, Jung-hee, a decision has yet to be made, but there is a belief that they might extend the social distancing guidelines here in the metropolitan area.
Yes, Sunny. Well, we'll have to listen to what the country's health minister has to say in about 25 minutes from now. But it seems the government is leaning towards extending its strengthened level 2 social distancing measures for another week. Now, that means people won't be able to eat in at restaurants after 9 p.m. and only takeout orders will be taken at franchise coffee shops for another week. Thanks to the enhanced distancing measures which kicked into effect 2 weeks ago, Korea's daily caseload has dropped by a significant margin, but from over 400 down to the 200s. But it is the government's view that the situation has yet to completely stabilize. This is what Seoul's Prime Minister Chung Se-kyun had to say this morning. Take a listen.
We don't want to start another crisis by carelessly easing social distancing measures. We must exert our full efforts until the curve is clearly flattened. It pains me to think about the impact of these measures on the economy and the disruptions to people's daily lives. But we must tighten the screws and reduce the rate of infections if we want to avoid dealing with an even bigger problem.
Well, Chung, it seems stringent social distancing guidelines here in the capital city especially has led to fewer people outdoors after 9 in the evening.
Right. Well, data shows that there was clearly a big reduction in people's movement this week. Now, the Central Disaster and Safety Countermeasures Headquarters analyzed the movement of people through signals from their mobile phones. Now, it appears that on August 29th to 30th, which was last weekend, there was an over 25% fall in the movement of people to areas outside of their residence. Use of public transit like buses, subways, and taxis also dropped by over a quarter. There were also 13% less credit card transactions during the period.
Right. Chung, like I mentioned at the start of the program, concerns are also mounting over the growing presence of patients in critical condition here.
Right, Sunny. Since Korea began reporting high number of daily caseloads beginning in mid-August, the number of critically ill patients has also been rising at a very rapid and worrying pace as well. Now, throughout this week, the daily increase of patients in critical care has been in the 20s and 30s. And as of Thursday, we have a total of 154 critical patients. Now, this is quite serious because in mid-August, we only had 10 patients in critical condition. This may be due to the higher number of elderly patients who have weaker immune systems and are more vulnerable to serious illness than those who are younger. Another problem we're facing is the shortage of hospital beds for patients in critical care, especially in the metropolitan area. Take a listen to what health authorities had to say about this earlier this week.
We reported over 400 new cases on August 25th and the 26th. Considering that new patients typically slip into critical condition within 7 to 10 days of being infected, the number of severely ill patients may continue to rise until this Sunday, and the number of deaths may increase as well.
That's a very bleak outlook right there. Also in related news, Chongi, I hear there's been more research on COVID-19 antibodies.
Right. According to a study conducted in Iceland, people may retain antibodies for at least 4 months after being infected with COVID-19. Now, the research was focused on 500 people who took more than one antibody test. And the study actually found that their antibody levels rose in the first 2 months after being diagnosed and remained stable for the next 2 months. Antibodies were also found in quite a number of people who had no symptoms of COVID-19. But the research was inconclusive on whether these antibodies could provide useful protection against the virus.
Meanwhile, what is the latest on global efforts to ensure equal distribution of vaccines, Chongi?
Right, Sunny. According to the Gavi Vaccines Alliance, 76 upper middle income and high income countries have signed on to join the alliance. And those countries now include Japan and Germany, Norway, and South Korea is actually also a part of it as well. The U.S. has not joined the alliance because Trump is opposed to WHO involvement, and China has not signed the agreement as well, though it has given a positive signal. Countries wishing to join this alliance have until September 18th to do so. There are currently 9 COVID-19 vaccine candidates with a further 9 under evaluation. The goal is to secure and deliver 2 billion doses across the globe by 2021. On top of securing vaccines for their own citizens, wealthy nations may also partner up with poor nations to provide vaccines in the form of donations.
Well, that is good to know. All right, Chongi, thank you for that coverage. Hope to see you again soon.
My pleasure. Thank you.
Right, now COVID-19 is not simply a public health emergency, it's also a psychological battle against fear and uncertainty, which appear to be aggravated by misinformation. Accordingly, in a bid to keep you accurately informed, we walk through the facts and fiction about COVID-19 in this next report.
The latest studies on COVID-19 are challenging our existing knowledge and understanding of the coronavirus, and have even overturned initial research findings from the early days of the pandemic. Among them is the belief that children are relatively less vulnerable to infection compared to adults. This notion was reinforced by the age distribution of Korea's COVID-19 cases, with patients under the age of 20 accounting for less than 10% of the total. However, new research in the US has found that children are far from immune, and in fact carried more quantities of the virus within their bodies compared to adults.
Like adults, kids may get infected. The fact that they have the virus in high loads, it implies, even if it's not been proved by our paper and any papers published so far, they can spread the virus.
Meanwhile, there's a consensus among experts that confined and crowded spaces should be avoided in order to minimize the risk of COVID-19 infection. But a group of researchers in Germany were surprised to discover a low rate of transmission on board a confined air passenger jet after conducting studies on a group of passengers who had flown from Israel to Germany back in March.
Rate of transmission was likely reduced because of the air circulation in the airplane cabin, because we know that the air circulation, the air goes from the ceiling to the floor of the airplane, and then it passes through filters that are capable of filtering out even very small particles. So this type of air circulation and filter likely reduced the rate of transmission.
The researchers did stress, however, that infections on board an aircraft are highly possible when passengers do not wear face masks. COVID-19 is widely known to spread primarily through respiratory droplets. Experts say there's a very low probability of the virus being transmitted through bodily fluids, such as blood, sweat, and urine. However, flushing a toilet could create enough force to launch virus particles into the air. The discovery of viral residue at an empty apartment in China has raised the possibility that the virus could travel through sewage pipes via microscopic airborne particles created by the force of a flushing toilet.
In realistic life, the virus is too small to be seen. It is actually invincible. So we just use the computer technology to simulate it. It's actually, from our finding, the turbulence is the main cause to spread the virus.
Amid the raging COVID-19 pandemic, cyberspace is being overwhelmed by a stream of information regarding the coronavirus, underscoring the importance of separating fact from fiction.
Any kind of information regarding COVID-19 should be confirmed by the experts. When you find any controversies among the experts, then you should perform a clinical trial. Then you can tell whether it is effective in human being or not.
It is easy to feel overwhelmed by the flood of information regarding COVID-19, raising the need to maintain better perspective by getting accurate information from credible sources.
What is not completely clear yet is for how long, how strong that immune response is, and for how long that immune response lasts.
Recent reports of reinfection of COVID-19 are raising fresh debate about immunity and vaccine development. For more on this reality, I have Professor Dr. That is David Kwak from Soonchunhyang University Hospital. Good to see you again, Dr. Kwak.
Good afternoon.
And joining us virtually is Professor Ivan Hung from the University of Hong Kong. It's a pleasure to have you on the show, Professor Hung.
My pleasure too, and good afternoon.
Right. Dr. Kwak, we'll start with you. Now, before we delve into today's topic, let's first touch upon the COVID-19 situation in Korea. The daily tally appears to be on a decline, as we mentioned, but authorities remain cautious. What are some of the main concerns right now?
Well, it's the fact that up to a quarter of the newly found cases, it's untraceable. We're not able to find the roots of the spread of the virus from 24% of the people that are newly found. And that's really devastating because up until a couple months ago, we were able to trace all of those who were actually spreading the virus and mitigate the virus from that point on. But having 24% or even increasing numbers of those that are untraceable means that we're really just walking through a minefield. We don't know where it may come from come up in the future. So we just have to really keep tight and just hide in the bushes, so to speak. Also, another factor is that up to 33% of the people are being comprised of elderly people. And that is also a very worrisome news because obviously with elderly population, they're more expected to have more severely ill conditions. So those are a couple of things that I could think of that as being very worrisome at this point.
Right, because compared to mid-August, back then we had 9 patients in critical condition, but now we have 157, I hear.
That's correct.
Right. Professor Hung, do tell us about the COVID-19 situation in Hong Kong and about the free tests being offered to people there to seek out, I understand, asymptomatic carriers.
Indeed, yeah, I think currently in Hong Kong, we have just contained our so-called third wave of the COVID-19. That began sometime in July, early July. But the good news, of course, is that we get it contained and we have now less than 10 cases a day, new cases a day. From the top that we have 140 cases in July. So I think the situation is has improved a lot. The measures that we have put in, of course, is universal masking, social distancing, and quick quarantine of patients who have been confirmed with the COVID-19. And of course, we have been giving treatment to our patient promptly with the interferon ribavirin double therapy. Concerning the screening test that we are offering, of course, with the help from the central government from China, we are able to set up a massive community screening that we are currently dealing with around 15 to 20,000 screening and up to like 200,000 screening a day. And hopefully with that measures, we'll be able to find those so-called asymptomatic cases currently lying in the community.
Professor Hung, I understand not all are in support of these free tests. Could you please elaborate?
Yes, I think there are a little bit of the so-called political issues concerning the community screening. Nevertheless, I personally believe that it is a very important measures in order to find and identify these asymptomatic cases. But the importance, of course, is that if these massive community screening could be done much earlier, perhaps like a month ago, then we will be able to catch most of these asymptomatic cases. But overall, I think these measures are very important, and I think these measures should be kept up probably until that we have an effective vaccine available and after people have been immunized with the herd immunity achieved.
I see. Dr. Kwak, the growing presence of asymptomatic carriers is also a problem here in Korea. Do you suppose Korea should also launch a nationwide testing campaign to seek out such carriers?
That'll be helpful, I think. It's really, we have been following all the traceable cases so far. And with the RT-PCR method, we were able to show with massive numbers of tests that we were able to contain to mitigate to a certain limited number. But now we're seeing so many numbers just springing up from everywhere. So we have to not only increase the number of testing, such as in a method of thorough screening for everyone, but also we have to start considering possibly taking in some other method of testing as well, such as in antibody testing, because that would also tell us possibly of past infections, not just the current infections that need to be isolated. So if we track as many possible ways as possible, we'll be able to cover more of the population who might or might have been infected and cover or mitigate the spread of the virus as much as possible as well.
Right. Professor Hung, I believe the first confirmation of reinfection was reported in Hong Kong last week. Please tell us more about this.
Yes, we reported the world first so-called reinfection. Is a young gentleman who was returned from Spain, and we were able to screen. In fact, we were screening every so-called returnees coming back through the airport, and we identified this case, and then we find that that he actually had an infection the first time. Sometime in March, and we compare the two strains that was isolated from him in March and also in August by the new generation sequencing, and we're able to find that basically there are two different strains. The first clade was actually the V clade, and the second clade was the GH clade. And of course, the most important surrogate marker is the D614G mutation in the spike protein in the second sample that we found. So we know that he has been infected by two different strains from the two infections.
I see. Dr. Kwak, a few days after this case in Hong Kong, a man in the US was also reported to have been reinfected with COVID-19. What implications do these cases have, for instance, on our efforts to develop a vaccine?
Well, I had the privilege of talking to Dr. Jerome Kim a few weeks ago. He was comparing this to the size, the strain mutation to the size of the whole hand, and this, the size of the mutation to be very minimal to the tip of the, possibly tip of the nail, fingernail. So in terms of developing vaccinations and possibly treatments, hopefully, it won't affect the development as too much. But also, in clinical findings, we are finding possible reinfections, as has happened with evidenced case in Hong Kong, not so evidenced in the United States' cases. But so it's something to look out for. But hopefully, what I'm anticipating is that it won't affect as much as those cases we've already found, meaning it won't affect the whole population and get the whole population reinfected, hopefully.
Hopefully we'll keep our fingers crossed for that. Professor Hung, I realize that more research is necessary, but based on what you know so far, are there any factors that may raise one's risk of reinfection?
Well, I think reinfection will probably become a common trend if you're not taking the infection control measures, say like if you're not wearing the mask, because we know that the antibody will drop after the first infection. For example, in this case, separated by 4.5 months, and that the antibody, which was initially detected in the first time, were not detected in him when he first returned to Hong Kong. And we know that this could happen to everyone. But the high risk, of course, are those who have had a so-called relatively minor infection the first time, then the antibody level will be lower. And again, in elderly people and people who are immunosuppressed or patients who are diabetic, who will not be able to generate the antibody in the first time, then, of course, these patients will be at risk of having a second infection.
Professor Hung, then, theoretically speaking, if your infection the first time around is rather mild, your second reinfection might actually be more severe. Is that the case?
No, I think if the antibody is, if you have an infection the first time, you had an antibody generated, then usually the second time, like in this case, the patient actually was asymptomatic the second time. So you have an antibody inside you. Even sometimes it is not measurable by the assay or detectable by the assay. You still have the memory from the B cells that you will be able to tackle this virus the second time you have this infection. But of course, if there's mutation of the virus, then the second time may be more severe if you have actually acquired a mutated virus, or that the viral load that you have acquired is much higher. Then you may have a more severe infection, like what happened in that case in the States.
I see. So the case in the US compared to the one in Hong Kong is that the patient in the US had a mild case in the first infection and a rather severe case in the second infection. Is that it, Professor Hung?
That's right, yeah.
I
so
see.
it's unusual to see that, but that probably is accountable by the mutation and possibly that the viral load that he has acquired in the second time is much higher.
Dr. Kwok, just for the sake of clarity, have we had reinfections here in the country, or did we have resurgences or relapses or recurrences of the virus? Could we make that a bit clear for the audience?
Sure. We had no evidence of reinfections yet. We found many cases that were showing symptoms again from the past possible infection, but they were not either studied through gene studies, so we could not find different strains of infections in one person. So we've had cases of relapses possibly and remittance possibly, but we just did not have any case that was proved to be a reinfection by a different strain of a virus yet.
But we do currently have a different strain of the virus here in the country, the GH strain of the virus. Given this scenario, what are the chances of reinfection here in Korea?
Well, as Dr. Hung said, it is possible that this new GH strain could reinfect other people who had been infected with B strains before. But these are really, in theory, we're only talking about. In clinical cases, we have not yet seen anyone who had been infected before to be reinfected again by the new GH strain yet. And I'm hoping it'll stay that way. Because if the GH strain was to infect everyone that had been infected with B strain, it is going to be a disaster, and that should really not happen. And hopefully, and also in relation to the measures that we're taking, we're keeping quite a strict measurement still, as we were taking back 3-4 months ago. So hopefully, in addition to the whole measurement we're taking, and also with the mutation of strain that's being hopefully minor in clinical effect, we're not going to see reinfections in people, really.
Right. Is it true that the GH strand is much more infectious, but it's relatively less fatal?
Well, I can't really say that to that extent. It was, in a lab setting, was studied to be many times more infectious than the other strains. But it hasn't proven to be either less fatal or more fatal than the other strains before. So we cannot really say the GH strain is actually either more dangerous or less dangerous. We could all suspect that it might be affecting the way the speed of the virus is spreading, and we can possibly blame to the mutation of the strain for the fast or spread of the virus that's currently happening, but it's all in theory. If we keep very tight physically, keeping the social distances and keep wearing the mask and keep physical blockades as much as possible, none of this would really matter.
Right. Professor Hung, the WHO claims that the Spanish flu of 1918 was overcome in 2 years. Now, given this time frame and given the advances in technology so far, the global health body believes that COVID-19 may be brought under control in a shorter time frame. Do you share this optimism?
Yeah, I think I shared his optimism, given the technology. And also that the vaccine currently several trials already in the phase 3 trial. So with the vaccine available, hopefully in the Q1 in next year, together with the people acquiring the infection naturally, hopefully we'll be able to achieve the herd immunity very quickly, more than 70–80%, maybe within 6 to 9 months. But most important, of course, is the vaccine hopefully will be available as soon as possible. This will this will probably bring up the herd immunity to the level that would required to bring protection to the community.
What about you, Dr. Kwak? Do you also share this optimism?
I actually do. As Dr. Hung said, in fact, when I actually counted all the months that happened in Spanish flu, I actually counted it to be a year and a half, not 2 whole years. So I'm hoping that it'll even be shorter this time with the advancement of the technology and the vaccinations that are being prepared. In many different countries, it is already going into trial 3, phase 3. So hopefully something good will come out of them, and we'll be able to start vaccinating everybody in the world, that we could achieve herd immunity in the whole global population and get done with this once and for all.
Hopefully, we'll have to keep our fingers crossed.
Yes.
I'll have to interrupt our studio session now for a little bit to bring you the regular afternoon briefing, which has been delayed by almost an hour, well, 50 minutes to be exact. The briefing has yet to begin, of course, but in that particular briefing, we expect government officials to make their decision on whether or not to extend the level 2.5 social distancing guidelines that have been put into place here in the metropolitan area. Now, these guidelines have kept restaurants and bakeries, even food trucks, to close their on-site dining by 9 in the evening and to be available only for takeout services from 9 in the evening to about 5 in the morning the following day. Cram schools, gyms, all indoor sports facilities have also been asked to remain closed until this coming Sunday to ensure that the latest outbreak here in the country is brought under control. Now, there is much speculation on whether or not the government will decide to extend these stringent so-called level 2.5 social distancing measures, but there is a lot more talk with experts claiming that the possibility of an extension is quite likely given the growing presence of asymptomatic carriers as well as the presence of infection routes, transmission routes that cannot be identified. We also have a growing number of patients in critical condition. As of today, that is Friday, the total number of patients in critical condition stands at 157. Now, this compares sharply to the 9 that we had in mid-August, once again raising concern that not only the infection rates but also the death toll is likely to surge. Now, on the screen, we have the numbers for this Friday here in Korea. We have less than 200 cases at 198, raising our total number of infections to 20,842. We have lost 2 lives, raising our death toll to 331, while those in quarantine stands at 4,728. We have 254 people who have fully recovered from the infection, raising our recovery rate to 15,783. Now, from that number, about 1,500 people have donated their blood plasma, hoping to trigger the convalescent therapy that officials are hoping will seek to ease the contagion, the illnesses here, that is. Now, on the screen, we also have the social distancing guidelines for the rest of the country. Of course, the guidelines here in the metropolitan region have been enhanced. At the moment, you can have indoor gatherings of a maximum of 50 people across the country, with the exception of those here in the metropolitan region, a maximum of 100 people, outdoor gatherings. This, of course, are guidelines under level 2 social distancing and not level 2.5, which is the case here in the metropolitan region, including Seoul, Gyeonggi Province and Incheon City. No spectators are allowed at sports venues, and operations of high-risk facilities, which include a total of 12. That would be buffet restaurants, as well as cram schools of more than 300 students not allowed to operate. We have schools being asked to take up remote classes or a hybrid of both offline and online classes. Now, we are still waiting for that briefing to commence, and perhaps while we wait, we can take a look at, we see that they are preparing for the briefing, but it is yet to start. So perhaps, Dr. Kwak, I can ask you one more question before we go back to that briefing. Dr. Kwak, the 2.5 social distancing measures that we had here in place in the metropolitan region, do you believe they've led to some form of tangible effect?
Well, time-wise, I don't think it has taken its toll yet. In my personal view, I hope it actually takes up to level 3. Because in medicine, we have this therapy called pulse therapy. When using certain medications, it's better to use the maximal level of a certain medication to eradicate certain infection sources rather than just using a mediocre level of it and keep going on with it. So in this case, if we were to actually completely lock down and block everyone just from coming into contact with anybody, we will have possibly zero numbers of infections. But realistically speaking, obviously that is not so realistic and that's not possible. So for the government to take measures, I think we could do better.
Right. Now, I understand the briefing is about to start. We'll come back to you after this briefing.
We are also joined by Mr. Han Sang-bae today and Mr. Choi Young-bum from the Labor Ministry for this meeting as well. And we also have a sign language translation available. First of all, here is Health Minister Bang Neung-hoo with the explanation on the COVID-19 response. I am Health Minister Bang Neung-hoo. And today we are facing a widespread of the COVID-19 and we are at a very critical moment to determine our future outbreak of the COVID-19. On the 15th of August, we also had the daily number of increasing of the COVID-19 patients from 100 and it peaked to about 400 this month as well. And thanks to our participation, we were able to contain the large number of increase, and we are seeing a steady decline in the number of the on-day increase of the COVID-19 patients. And this was all possible thanks to the participation and cooperation given forth by the public. And as the health official, I would like to extend my deepest gratitude to all of the public. Actually, looking at the mobile traffic during the past weekend, we have seen that the mobile traffic has decreased by about 25% compared to the previous weeks. We were at a very important moment of crisis. However, we were able to overcome this thanks to the participation from the public. And once again, we have witnessed the great potential energy that were lying in the hands of the public. And thank you for that. However, it is too early to become complacent. In the metropolitan area, we have a continued 3-digit on-day increase in the metropolitan area for about 20 straight days. And as for the cluster infections, it is happening at a very diverse venues that are closely related to our daily lives, including cafes, restaurants, and so forth. And during the past 2 weeks, we have seen those in the untraceable patients account to over 20%, and our capacity of quarantine has become very weak right now. And those in the critically ill patients are also increasing, and this is also giving a great burden on our medical capacity. Ladies and gentlemen, we are at a time when we need an extended form of a social distancing measure. And right now we have the intensified quarantine measures for the metropolitan area and the social level 2 distancing for the entire nation. And they are deemed to come to an end on Sunday this week. However, we believe that until we have a clear decline in the number of on-day cases, there is a need for us to extend such a measure. And we believe that taking this opportunity, we need to yield clear results of our quarantine measures. To this end, the government has decided to extend the level 2 distancing measure for the entire country for 2 more weeks. And also the level 2.5 social distancing will be also extended as well. And the entire measures put in place for the entire country will be extended up to the 20th of September. And this will also ban the gatherings of more than 50 people indoors and more than 100 people outdoors, and this will also ban the operations of high-risk facilities. And the churches the operation of churches will also have stricter recommendations by the local authorities. And in the metropolitan area, we will have an extension of the intensified social distancing by another week. However, we will also have an expansion of such detailed measures. And considering the damages incurred on the public's livelihood, livelihood, we have decided that the intensified social distancing will be extended for just another week. And all of the franchise coffee shops, as well as the franchise coffee shops being only able to take out and delivery, will also become maintained. And this will be also expanded to include bakeries, ice cream shops, and other dessert stores in the form of a franchise as well. And we believe that these come into the reflection that they have a similar risks of infection, as a large number of people are clustered in these stores. And as for the private academies, they will also continue to have a ban on gatherings, and we will have only remote classes as well. And as for school reopening, we will have a separate briefing by the Education Ministry going forward. And please refer to the press kit for more information. And these measures will be taking place from midnight 7th of September and until the 13th of September for the metropolitan area, and until the 20th of September for the nationwide. And until we have a stable number of the decline, these measures will be downgraded going forward. However, we believe that the extended measures for the nationwide, we will be able to choose adjust these measures prior to the deadline once we can keep the situation under control to a certain extent. And we believe that many self-employed people are witnessing great damages, and we would like to apologize in advance for these people. We believe that these are very much needed decisions. However, they also embrace and they also put at cost big damages of the livelihoods of the public. And we also believe that with prolonged measures, many of the public are feeling fatigue over these measures as well. However, as we have seen in the gradual decline in the number of cases recently, we believe that our efforts will also bring great results going forward. And we will also like to ask you to remember each of the efforts that are taking place by your neighbors. And for the residents living in the metropolitan area, please refrain from making outdoor visits, and please minimize physical contact with others until the 13th of September. And if you continue with your efforts, we believe that we can flatten the curve going forward. And the health ministry, as well as the medical practitioners have made an agreement, and we have made an agreement that we will resolve any contending issues through dialogue and negotiation. And especially at a time when COVID-19 is spreading at a very fast pace nationwide, we share the same view that we need to stay united and have a solidarity to treat the patients and to safeguard the lives and the safety of the public. And we would like to apologize to the public for bringing a very worrisome situation. And going forward, we will cooperate fully with the medical circles, and the medical circle will cooperate with the government as well. We will exert our full efforts to combat the COVID-19. And the medical association have also agreed to halt their collective action of a walkout, and they will also return to their duties as soon as possible. And we ask the trainee doctors to do the same and to exert your missions as well. And as for the medical school students, we ask you to also take the scheduled qualification medical examination that is going to take place as scheduled. And we will also have an open-mindedness, and we will also engage in candid dialogue as for the issues, contending issues, including the expansion of medical school admissions and so forth. And the dialogue with the medical circle, between the medical circle and the lawmakers, will also carried out candidly. And we will also listen to the opinions of the medical circles, and we will make sure that we come up with great policies that are helpful and beneficial for both the public and the medical circles as well. And we will plan a brighter future pressure for the medical circles going forward, and the government and the medical circles will cooperate fully and to combat the COVID-19, and we will bring and to devise a greater and brighter blueprint for all. And the government and the public as well as the medical circles will cooperate fully, and we believe that if we do so, we can overcome any outbreak that we face in the future. Thank you very much.
예, 장관님 시간 관계상 질의응답.
Right, that was the Health Minister Park Neung-hoo with Friday's afternoon briefing. Now, level 2 social distancing guidelines for the entire country have been extended for 2 weeks to end on the 20th of September, while level 2.5 social distancing guidelines have been extended for the metropolitan area, including the capital Seoul, the city of Incheon, and Gyeonggi province. Now, these level 2.5 social distancing guidelines for this area has been extended, that is, by about a week to the 13th of September. Now, this move, Dr. Kwak, was largely anticipated. As a doctor, what are your thoughts on the decision to extend these social distancing guidelines by the government?
I agree with what the government is taking. I think our government is really trying its best to mitigate the virus, and it's the minimal step it can take at this moment, realistically speaking, to lessen the virus, reduce the spread of the virus. If we were to take stronger measures, it will affect the economy, and that's also a big impact that we could also have for ourselves. But if we lessen and reduce the level of measurement, it is also going to work in the opposite way and quite possibly open the door for the virus to actually go around again. So at this point, 2.5, I think is quite reasonable. Personally, just speaking, though, if we were to take very short amount of time of higher measurement, let's say 3 days, just 3 days of total blockade, I think that also might be very helpful in the stoppage of the spread of the virus.
I see. All right, Dr. Kwak, thank you very much for your thoughts and always for being with us.
Thank you for having me.
Right, well, that brings us to the end of this week's coverage of COVID-19. A 2-week nationwide walkout by trainee doctors appears to have come to an end amid an agreement with relevant officials. Given this backdrop, all hands are back on deck for the continued fight against COVID-19, and authorities are therefore urging for continued caution against contagion this weekend as well. Do take care. See you on Monday.